I'm Emily Mashak, and you are listening to Tuned Into NoCo, Townsquare Media's show that lets you know what matters in NoCo. I'm talking today with Kelly Osthoff, the Regional Director of Programs for the Alzheimer's Association, about June, which is Alzheimer's Brain and Awareness Month. Thank you so much for speaking with me, Kelly.
Thank you so much for having me, Emily.
Now, let's start off with the basic question. How does the Alzheimer's Association define Alzheimer's? What is it?
Alzheimer's is a progressive brain disease that is the most common cause of dementia. So this is actually the most common question that we get. And that is, what is the difference between Alzheimer's and dementia? Because frankly, people often don't know because they're used so interchangeably. So dementia is where I like to start. And that is an umbrella term for a set of symptoms that most often include memory loss, changes in language, navigation issues, but can also include behavioral changes, some physical changes. And for many years, it was believed that people got dementia simply due to old age. This is where terms like old age senility come from. But as we have learned more and more through the research, we now know that there are many causes to dementia, and age is no longer believed to be a direct cause, and Alzheimer's disease is the most common cause of dementia. So in short, I like to say that dementia is what you observe in someone's changes in abilities, and Alzheimer's is the disease in the brain that is the most common cause to dementia.
So June is Alzheimer's and Brain Awareness Month. What do you think people need to be more aware of when it comes to Alzheimer's?
Well, as I said, for decades, people thought that old age caused dementia, that as people got older, they were supposed to get dementia, that it was considered a normal part of aging. And now we know that that isn't believed to be true. What we're learning through the Alzheimer's research around finding a prevention or a treatment for Alzheimer's is that there are actually things that we can do at any age to take care of our brain health. So that's really what June gives us a platform for, is to raise awareness around Alzheimer's disease, because anyone with a brain is at risk for Alzheimer's disease and other causes of dementia. And what we've learned through the research is that there are things that we can do earlier in life to reduce our risk for Alzheimer's disease. And we always talk about our 10 ways to love your brain. And those are very actionable things that we can do today to lower our risk of Alzheimer's disease and take care of our brain.
Mm-hmm. Can you go into more detail about what those are?
Sure. The 10 ways to love our brain really come from 4 different areas of our overall health. And that is our physical health in regards to diet and exercise, our cognitive health, our social health. So those are really the 4 areas that we look at when we talk about brain health: diet, exercise, really our overall physical health, and then social and cognitive health. So the 10 ways to love our brain, they all relate to those 4 areas, but it includes breaking a sweat, getting your heart rate up, hitting the books, continue to learn across the lifespan, quitting smoking, and just looking at your overall heart health in general. So looking at your blood pressure and diabetes, taking really good care of our brain and preventing brain injury, getting a really healthy and balanced diet. The diets that have been looked at are the Mediterranean and DASH diets, getting enough sleep, being cognizant of our mental health and overall well-being, continuing to challenge ourselves and doing that cognitive exercise, and then staying socially connected. So those are just 10 ways that we can take care of our brain as we get older, and we're never too young to start taking care of our brain.
Those are all great tips. I know that June also celebrates something called the longest day. Would you be able to explain to our listeners what that is?
Sure. The longest day is every year during June, typically on the summer solstice. So we know that that is the longest day of the year. This year, it is on June 20th. And the longest day is our way to take one day to raise awareness about Alzheimer's disease, but also to take part in activities that we enjoy either individually or with others, maybe in a virtual space, to raise critical funds to find a cure for Alzheimer's. So it is not only an awareness event, but it is also a fundraising event. And we have selected it to happen on the summer solstice, the longest day in the year, I think fittingly to honor the long days that our caregivers have each and every day as they're providing care to their loved ones with Alzheimer's and other forms of dementia.
How can people turn the longest day into a fundraiser?
Absolutely. So the first step would be to visit our website and register your longest day team. And that is www.alz.org/TLD. And that's where you can go on, register your longest day team and your fundraising idea. So you'll commit to an activity that you're going to do on the summer solstice and ask your friends to sponsor you through donations. And that is the website you go to register.
Now, we're in the middle of a pandemic, and COVID-19 has obviously presented challenges for everyone, but I can imagine it's especially hard for Alzheimer's patients and their caregivers. Can you shine a little light as to how the pandemic has affected these patients and their families?
Absolutely. So the pandemic has certainly affected all of us, but it has caused exceptional burden to our older adults, whether they're living at home or living in long-term care facilities. So first and foremost, the Alzheimer's Association has taken everyone's health and safety into its top priority and has moved all of our programs and services that typically happen in person to a virtual space because we recognize that our caregivers and our people living with dementia are and have been really impacted by this pandemic. For a few months now, families have been unable to visit their loved ones living in nursing homes or assisted living facilities. So that has caused a new challenge for family caregivers who are unable to visit their loved ones. So that has caused sadness for our caregivers who have family members in facilities. It's possibly caused isolation for the people with dementia living in facilities who really rely on that in-person and physical touch with their family and friends that they're not able to get at this time. Now, I do want to applaud all of our frontline staff working in facilities who have done absolutely everything that they can to keep their residents safe and healthy, to keep them engaged while maintaining social distancing rules, and also to keep them happy, because we know that residents in long-term care facilities are seeing new levels of isolation. Additionally, if family members have their loved ones with dementia at home with them, this poses a set of its own unique challenges. They're possibly not bringing home care in because they don't want visitors in their home, or they're not seeking the typical respite resources that they are able to seek during normal times. We know our caregivers may not be getting out and about as much, and so they're feeling likely more cooped up than all of us as they're having to remain at home with their loved one with dementia with little support and help. We also know they're facing new caregiving challenges. We all know that it's critically important for us to wash our hands for 20 seconds at a time, and for people with dementia and short attention spans and struggling with the concept of time, that can be an added challenge. So certainly our home-based caregivers are facing additional isolation, but then also new challenges in their own caregiving.
What advice would you have for caregivers during this pandemic? How can they try to work around these challenges?
Yeah, well, first and foremost, we want caregivers, so family caregivers, whether they have a loved one in the home with them or their loved ones in a facility, we want caregivers to connect with the Alzheimer's Association now more than ever. We have created COVID-19 and caregiving materials and education programming to equip our caregivers with the strategies they need to keep themselves and their loved ones healthy and safe during this pandemic. So that would be their first step, is call the Alzheimer's Association. And they can call our helpline at 24 hours a day, 7 days a week at 800-272-3900. And our helpline counselors can provide emotional support, but also information on those local but virtual programs and services, like the COVID-19 and caregiving presentation or a virtual support group. So that's their first step, is to get connected to the Alzheimer's Association. But then second, I think it's really important for caregivers to take care of their mental health. We know that caregiving is stressful during normal times, but this pandemic certainly has added an extra challenge to them. So we really, really recommend that caregivers take diligent care of their mental health during these stressful times. We know that we're all stressed out, our emotions are all heightened as people living in this pandemic, but for caregivers, they just have that added layer of stress.
Now, on the note of taking care of mental health, what signs can people look for to see if they or a loved one are at risk of developing Alzheimer's?
Absolutely. When we hear Alzheimer's and dementia, we instantly think of memory loss. And memory loss is one of the most common symptoms of dementia. So that's one thing to look out for. And this can manifest in different ways. So it could be possibly your loved one is repeating a question or a story a few times in the matter of a few minutes. But memory loss can also show up in a different way that is more subtle. It can include changes in their time management. Possibly they're becoming so forgetful that they have to develop new systems to keep track of their calendar, the activities, or what has been done and what they need to still do. Memory loss is just one of those 10 warning signs that we talk about. Other changes include challenges with planning and problem solving. So possibly someone once was able to follow a recipe or cook something from memory, and now they're struggling with that process. But it also can include changes in judgment and personality and behavior. So it really is a complex set of changes that take place when someone is developing dementia, and it can look different for each person. So if someone is concerned that their loved one is exhibiting cognitive changes that could include memory loss, changes in language, behavior changes, we recommend that they really do two things. First and foremost, talk to that person's primary care doctor. That's a great place to start, is talking with the primary care doctor at their annual visit to do some cognitive screening. Secondly, it's always great to call the Alzheimer's Association. While we certainly do not diagnose people, we can talk through the changes that are common in dementia and what might the next steps be.
Well, thank you, Kelly. It's great to learn, and it's great to know that the Alzheimer's Association is there for people who are struggling with this. Is there anything else that you would like the public to know?
I think right now, what is so important is that even though we might not be doing activities in person, so we might not be able to visit our friends and family in care communities who have dementia, or we might not be able to go to a support group. The Alzheimer's Association is still here, and we're still helping people, but we're just doing so virtually. So please stay connected. We know now more than ever during this pandemic, our caregivers and people living with dementia need us, and we just want to let people know that we're still here.
That's a great message. Well, thank you again, Kelly, for taking the time to talk to me. I'm glad we were able to help get this information out, and I know our listeners will appreciate it.
You bet. Thank you so much for having me.
Again, that was Kelly Osthoff, the Director of Regional Programs at the Alzheimer's Association. To learn more, visit alz.org/co.